Dear students, today's topic is CY-TB test, which is a novel test for the diagnosis of latent tuberculosis. So, which are the three tests to detect latent tuberculosis? Tuberculin skin test. There were certain drawbacks of tuberculin skin test, so therefore improved TB test known as CY-TB test is being used, which utilizes the specific antigen. In today's video, we are going to see the details about CY-TB test. And third test, which is done in the lab, that is interferon gamma release assay, that requires sophisticated laboratory setup, which is a costly. So today we are emphasizing CY-TB test. So CY-TB test is indicated in which individuals? In India, CY-TB test skin test for detecting latent tuberculosis infection. It is indicated for the individuals aged 18 or above, and it is included in the screening programs like healthcare professionals or contact of active cases. It is indicated. Contraindication, if there is a known hypersensitivity, it is contraindicated, and severe reactions by previous severe TB. These are the contraindications. Then what is the TB test? It is an improved skin test, intradermal skin test, which is the next generation TB test, high specificity for detection of TB infection for diagnosis of tuberculosis, and it is better than Monto test. And there is no interference because of prior BCG vaccination or infection due to other mycobacteria. And what are the antigens used? It uses two antigens for testing, that is the ES86 and CFP10. Then what is ES86? So it is an early secreted antigenic target, which is a 6 kDa, and it is a crucial virulence factor and T cell antigen produced by MTB, and small secreted protein found in complex with CFP10 and plays role in a phagosome rupture and immune response modulation. So it is a key virulence factor, and it also T cell antigen which triggers the strong immune response, and this particular antigen ES86 is also used in quantiferon TB, which is a IGRA, interferon gamma release assay, along with CFP10. So if you see this ES86 and CFP10, these two antigens are also used in IGRA, that is interferon gamma release assay. This is also a vaccine target, and it interacts with host cell causing T cell activation. So this is the first antigen. Another antigen, is CFP10, which is a culture filtrate protein, which is a 10 KDA, which is again crucial role in pathogenesis. And earlier it was called as ESXB, protein secreted by Mycobacterium tuberculosis. And function is, it is a virulence factor. It causes host cell interaction, modulating host cell behavior. Then it is a neutrophil chemoattractant and production of reactive oxygen species. So these two antigens, they are used as antigens in CY-TB test. So this is the antigen which is shown in the photograph, and it is manufacturer is Serum Institute of India. So Serum Institute of India has also, in association collaboration with the Staten Serum Institute Denmark, they have devised this antigen. So this antigen should be stored at 2 to 8 degrees Celsius in the refrigerator, and we should not keep in the deep freeze section. And in one vial there are 10 doses, and after first opening the vial can be used for up to 28 days, provided that it has not crossed the expiry date and the vaccine vial monitor has not crossed to the discard point. So what do you mean by vaccine vial monitor? So there will be distinct marking, and on that marking, if there is a change in the color, we should not use it. And then time of opening on the vial should be mentioned on the cap of the vial. So in one vial we can give 10 doses, and up to 28 days we can keep it. Now procedure is similar to Mentor test. The quantity of antigen injected is 0.1 ml, that is 0.05 microgram of each antigen with needle against person's skin. Insert the needle slowly at 5 to 15 degree just below the surface of the skin. Inject the solution slowly, forming 6 to 10 millimeter wheel, which is a pale raised area. Remove the needle without massaging or pressing the area, and immediately discard the used syringe in the sharp container. In case of minor bleeding, use gauze or cotton ball to dab the injection site. So the main criteria is 6 to 10 millimeter in size that bleb should be formed during injection. If it is not formed, that means it has not gone intradermally. So therefore it should be repeated approximately 2 inches from the original side, or it can be done on the opposite arm. Then come to the interpretation. The test should be read between 48 to 72 hours and never before 48 hours or after 72 hours. So we have to ask the patient, we have to give the fixed time and ask the patient to come between 48 to 72 hours. Then while interpretation, mark the induration, palpating with the fingers, and universal 5 millimeter cutoff has been established for CYTB, which indicates infection with Mycobacterium tuberculosis. Formation of vesicle, bullae or lymphangitis, ulceration, and necrosis at the test site should be noted, as they may indicate high degree of sensitivity and hence presence of TB infection. So that is also considered as a indication of infection. So you can see there is a induration. Now this is the comparison between CYTB test, then tuberculin skin test, and IGRA. CYTB test, if you see the first point, specificity is high, and also in BCG vaccinated individuals it is helpful, whereas tuberculin skin test low in BCG vaccinated and IGRA high also in BCG vaccinated. So out of these three, the CYTB test and IGRA, it is having high specificity. Then sensitivity, all the tests they are having high sensitivity. Then ease of use, CYTB and tuberculin skin test, they are field friendly. Single cutoff allows simple test interpretation in CYTB, whereas in tuberculin skin test, it is a field friendly, but the test interpretation is complex. However, IGRA requires lab infrastructure, sophisticated equipments, so therefore again it becomes out of reach to implement on the mass scale. Then come to the cost of test. CYTB cost of test is low, tuberculin skin test cost of test is low, whereas IGRA cost of test is high. Then manufacturing is robust with high yield, well defined and completely characterized, whereas tuberculin skin test, the manufacturing is complex and which is an old product. IGRA also manufacturing complex, multiple components are there. So if you compare, the scoring of CYTB is higher. Now, if you consider the patient with special population, in children, CYTB is more robust, and tuberculin skin test affected by young age, whereas IGRA also affected by young age. Then people living with HIV, CYTB is again scores more robust with low CD4 count, whereas tuberculin skin test requires information of HIV status. Then IGRA affected by HIV and low CD4 count. So these are the comparative statement about these three tests for the diagnosis of latent tuberculosis. Now this is the last slide. Concluding remarks. Latent tuberculosis is diagnosed by three tests. These three tests which are available. One is the tuberculin skin test, another one is the CYTB test, and third one is the IGRA, interferon gamma release assay. Out of these three available tests, tuberculin skin test and CYTB test. It is having capability to implement in the field level. However, CYTB test being a specific antigen which is used in CYTB, there is a no drawback of interference by prior BCG vaccination. There is a no drawback of interference with the infection with a mycobacteria other than tuberculosis. So, field application is possible, lack of drawbacks over tuberculin skin test. So, all these are the promising features. Improved specificity, wide scale implementation of this test in the field is helpful in the global elimination of tuberculosis. So, take home message is tuberculin skin test and CYTB test. These are the skin tests. Out of that, CYTB is far superior and it is rolled out by NTEP. Presently, the antigen being supplied and it is being implemented for diagnosis of latent tuberculosis. Thank you for your patient listening.